If you're watching this, you just had a shoulder replacement. So first of all, I'd like to thank you for entrusting in me to get you back to a pain-free and active lifestyle, specifically in regards to this shoulder. We wanted to show you a few things in regards to your post-operative care that we think can help you out. So the first thing we want to show you is your dressings. This dressing right here is actually a waterproof dressing, and it can last for over a week. So the goal with this thing is to keep it on until we see you back in clinic. You can shower with it on, etc. One thing to note though is you have this block that's in your neck. It's put there by anesthesia before your surgery to help with pain. You may not shower until the block is out. Now you or your family member will be taking that out, and when you take it out, once your pain is not relieved anymore by the block. Now that can last for some people a day, or for others 3 days. Whenever it stops relieving your pain and stops working, that's when you can take it out. The way you take it out is you just take this adhesive back like this, and you grab the little thing and pull it right out of the skin, just like that. If there's any sort of leakage there, you can just use a little band-aid, and that's all you should need. It's just a small little bit of catheter that's easy to take out. But in regards to this dressing here, if it falls off or you have an issue with it, you can just put some gauze over the top of it and that would be fine. In regards to activity after your shoulder replacement surgery, you shouldn't need to do a lot with it, but we do want you to come out of your sling about 3 to 4 times a day in order to get your wrist and elbow moving. While you're still in your sling, you can move your fingers, move your wrist up and down, but 3 to 4 times a day, we want you to pop this off and come out of your sling in order to move your elbow. And we just want to move it full extension to flexion as high up as you can go. So back and forth. Probably do that 3 to 4 times a day, 10 to 20 times, just to make sure your elbow doesn't get stiff. Some big precautions in regards to shoulder replacement surgery. In order to get to the joint, we have to take down this front tendon. And you really put a lot of pressure on the repair of that tendon if you externally rotate your arm out, so going this way. So the goal is to keep this hand close to your body so we can allow for that tendon to heal. So no arm movement above your head and no external rotation out, because that could affect the repair of that muscle that we did. Besides that, just wear your sling most of the time. You can occasionally come out to get the elbow moving, but besides that, we'll see you back in about a week or so.